Greetings viewers, my name is Dr. Supratik Bhattacharyya. I am the Director of SKN Diabetes and Endocrine Center, Noihati. I am also consultant endocrinologist based at Kolkata, AMRI Hospital Salt Lake, as well as Apollo Sugar, Newtown and Salt Lake. Now we are here today to talk about the adverse effects of having high blood pressure and why we should be controlling blood pressure from the very beginning. Now, we know that if a person has got a very high blood pressure, it's going to adversely affect all the organs in the body, whether it's the eyes, the brains, the kidneys, the nerves. Every single organ of the body is going to be adversely affected because of high blood pressure. So I'm going to delve into one of the organs at a time, and let's talk about the arteries. So what happens is that, the arteries become narrow, and when the blood pressure increases, the blood supply to the vital organs of the body gets cut off, and that's the reason why we might have a stroke or a heart attack and things like that. Or at times a portion of the artery might bulge out, what we call it as aneurysm, and at a later date that might burst and cause even further problems. When it comes to the heart, we know that there might be coronary artery disease, and because of cut off of the blood supply to the heart, a portion of the heart muscle might get damaged and it doesn't work properly at a later date, and what we usually call it as ischemia or even myocardial infarction. There might be enlargement of the left side of the heart because heart is pumping against a force all the time, against high pressure, and because of that the left side of the heart becomes enlarged. That might eventually cause heart failure at a later date as well. When it comes to the brain, there might be cut off of the blood supply to the brain. It might be because of the very high blood pressure, or there might be sudden increase in the flow, what we call hemorrhage. So either ischemic changes or hemorrhagic changes might be visible because of high blood pressure. Kidney is another organ that gets adversely affected, and this happens in the form of either the artery of the kidney gets affected, artery and the vessels as such, or the nervous supply. So we might end up having renal failure, or there might be scurrying of the kidney as such. So at a later date we see the kidneys getting shrunk in size, smaller in size, and they lose their functionality. When it comes to the eyes, we have the nerves that supplies the back of the eyes, and that might get affected because of high blood pressure, or there might be hemorrhagic changes or bleeding at the back of the eye, what we call retinopathy. There might be sudden bouts of very, very high blood pressure, and that's known as hypertensive crisis, when the blood pressure rises beyond 180 or so, and that might be an emergency where the patient needs to seek advice from a doctor or even get admitted because of immediate reduction of blood pressure. Otherwise it might be fatal as well. Also, I might say that blood pressure can be increased as a part of a metabolic syndrome, which leads on to insulin resistance and diabetes at a later date, and that comes with adverse cholesterol levels or dyslipidemia, increase in the waist, hip circumference, and also high blood pressure. So overall, I think the blood pressure has to be treated very well with a healthy lifestyle. A person has to walk briskly for 30 minutes a day, not have a sedentary lifestyle, should be cutting off added salt in the diet as such, should be taking fluids to moderations, and also there is a place for yoga and other breathing techniques which helps improve the heart rate, etc. And of course, if your blood pressure is still not to target, you need to seek advice with a doctor. You have to keep your cholesterols at bay with statins, etc. And if you have a propensity to develop diabetes or already having diabetes, that also has to be taken care of. So stay well, stay fit, and stay healthy. Thank you so much.